Welcome to today's episode of Disease Diaries. Today's pages are all about pneumonia in Pneumonia Knockout. I'm your host, Aaron Flem. I'm here with expert on the subject, Aaron Sputumman.
Hi, it's me, Aaron Sputumman.
Let's talk about pneumonia. So, What is pneumonia?
So, funny thing you asked. Pneumonia is it's a disease that can be caused by bacteria, viruses, and sometimes fungi. It's a disease that gets all up in your lungs, makes it a terrible day for you. You know, it's really hard to breathe. You're going to be coughing a lot. It's going to be really hard to get air in and out.
Gotcha. And what causes this?
As I said before, a bunch of bacteria, fungi, and viruses. The way it can be acquired is through like unsanitary surfaces. Like if you've been in like the hospital, you can get it from that if protocols aren't being followed. But you can also get it from the community. Say if you're like at the grocery store and you're shopping, and then there's like some old grandma that's coughing, and then you get a little too close to her. Oh, now you're contaminated.
I see. All right. So, what exactly does this do in the body?
So, it gets into your lungs, and it inflames the tissue. So it gets them all hyperactive. So it makes them really thick, and makes gas exchange a lot harder. So in your lung, you have these little grape-like structures called alveoli. And basically, when you breathe in, air will go down your trachea, which is your windpipe, and go into your lungs. And at the alveolar sites, that's where your body will exchange CO2 for O2. So since pneumonia will inflame that, it makes it a lot harder to do, which in turn will make it very hard for you to breathe. And yeah, it's just not a good time.
I see. So what are some ways of treating this condition?
Antibiotics, especially if it's bacterial, because that you can either get an injection or take some oral medications. And then those will slowly disseminate into your lung, reducing inflammation, and that will allow gas exchange to occur normally again. You can also have like a nasal cannula, which are essentially these little tubes that you can wear, and they'll go into your nostrils, and you can pump air into it from 1 to 6 liters. So that's quite a bit. And if you need anything more, there's also a bunch of different contraptions that can help you get air.
Like what?
Like a Venturi mask. It's a mask that goes over your face, and it can go to even higher levels of oxygen nasal cannula. You also got a high flow nasal cannula, which is essentially the same thing as a nasal cannula, but it just pumps more. Yeah.
In what condition would you use that?
You would use that in a condition where your patient is really having a hard time breathing, if their oxygen level is below 94 or so. So essentially when oxygen is in your blood, you have a certain oxygen saturation. And most people are above 95 or so. But if you're having trouble breathing, such as the case of pneumonia, that can drop to like 80 or below. And if you get that low, that's really bad. You might start turning blue. So you want to use those devices to get that back up there.
Are there any at-risk populations for this disease?
Oh, yes, the older populations. Because as we age, our immune responses are a little slower. So, like, for example, if you, as like a 20-year-old, had like a little cut on your arm, that would heal pretty fast. That might heal within like a week or two or so. But for someone who's like 60 or older, that might take like a month. So similar situation to pneumonia, where if you're younger, you might, your body might just take care of it for you because of just the heightened responses. But since when you're older, your cells start deteriorating, your body might not have the defenses to fight back against pneumonia. Mm-hmm. And you might need to be hospitalized and get further treatment.
I see. So what you're saying is older populations are more likely to get it and also to have worse complications with it.
Yes, exactly. Mm-hmm. That's why it's very important to have mitigation measures for pneumonia. And a great way to do this, it's a classic for everything, and I bet all of you have heard it a lot, hand washing. You want to wash your hands, douse it with water, wash with soap and water for at least 20 seconds. Because, that will get your hands all nice and clean. It will reduce, contamination risk. Also, sanitize your surfaces. And if you do have pneumonia or you have any sort of pneumonia-adjacent disease and you're feeling really ill, stay home. Recover. And that's a great way to protect a community.
Gotcha. And what are some ways to tell if you have pneumonia?
Coughing, nausea, fever. Very similar to the cold. Also, if you're coughing, you might throw up some sputum, and depending on the color of the sputum, that can tell you what infectious agents in your body. So if it's green, that's probably bacterial. If it's any other color, that might be viral or fungal.
I see. So I've heard you can do sputum tests to see what different types of pathogens are in your lungs. Yeah,
exactly. So what happens there is, say if you're in the hospital, you have pneumonia, you cough up some icky green stuff. What they can do is they can get a little sample of that, put it onto a petri dish, and then they can have the culture grow for a few days, and then they can figure out by the different qualities of that culture what the organism is.
Interesting. I've heard chest x-rays are also a good test to see.
Yes, chest x-rays are wonderful because with an x-ray you can obviously see inside the body. And so if you have a lung x-ray or a chest x-ray, it will show you what's going on in the lungs. So if you have anything inflamed or if you have liquid in the lungs, it will show you that as being filled up, and which will give doctors and other medical staff a great point of reference to how to treat these issues.
I see. All right, we're going to have a break for a quick word from our sponsors.
Do you ever need to pee and it's really hard? Now introducing Cameron's catheters. Shove that right up that area and just have all the pee in the world. You don't need to worry about prostate. You don't need to worry about UTI zones. You can just use the catheter. You want to prank your friends? Cameron's catheters. Only $15.99 on Amazon.com. If you order now, you get 2 for free. Yeah, Cameron's catheters.
All right, we're back. Thanks to Cameron's Catheters for sponsoring us here. All right, so before we go, we're going to hear a few questions from our prying patrons. So, first off, my grandma had pneumonia and her chest hurt real bad. Is that normal?
That's a great question, Caesar 23. That's normal. If your grandma has pneumonia, common symptom is chest pain, because obviously as the infection's taking hold in the lungs, it's going to be very painful for that individual. And since the lungs are located in the chest, it's going to naturally be located in that area, and it might radiate outward.
All right, that's a good segue into this next question here. Is it a disease or an infection?
Great question, Kayla. It's an infection, which is a type of disease. I know I misspoke a little earlier before, but it's an infection.
All right. And here's one from John47. How does pneumonia get in the lungs?
Great question, John47. So, how how pneumonia gets in the lungs. It's so you can get pathogens either from your mouth or your stomach, and they'll enter the lungs just by way of like the bloodstream, or you can be like inhaling air particles that have stuff in them, or say if you have like some wacky infection in your leg and then it gets transported up into your lungs, it could cause the whole ordeal. So yeah, that's how it gets into the lungs. Yeah.
All right, very interesting. Okay, here's one from SadBoy64. My dog Adderall got pneumonia 10 years ago. Uh-oh. And my parents said he went to a farm to get better. That's not sounding good. Will he come back? Oh boy.
SadBoy64, I'm gonna do what your parents didn't do. I'm gonna have the balls to say, your dog's dead.
All right, let's move on. Okay, here's another one. What are some major complications?
Lung collapse, and fluid consolidation. It's like leakage, fluid leakage. So basically, with lung collapse, it's essentially the lung will collapse in on itself because obviously you can't support all the stuff that's going on in the lungs with the inflammation and like usually paired up with fluid. And so the lung will collapse in on itself, which will make it even harder for air to get in because the lung's kind of like a balloon. And so if you kind of like pop that balloon and make it collapse, you can't really get air in there effectively. And then for the fluid leakage, so basically if things aren't working well, you might get more fluid entering the lungs, which will even further block air from getting in there, which will further inhibit gas exchange.
All right, and where is this fluid collecting? Is it in the alveoli that you were mentioning?
Yeah. So basically, the little grapes that I was talking about before, they'll be drowned in some icky bodily fluids. So now when the air comes down, when the O2 is like, hey man, I want to get into those alveoli for your CO2, it's like really hard. Because there's like 5 different gates that are going out. Because now you have the inflamed tissue, which makes it harder, and then you got the fluid. It's just not a fun time.
Does not sound like a fun time. All right, well, that's enough questions for today. Thank you so much, Aaron, for being here.
Thank you for having me, Aaron.
Yeah, all right, well, to you all out there, please join us next time to hear another entry in our disease diaries.